You know, I always say to people, when politicians do this, they don't mean it. They want you to keep clapping. We're going to start taking questions now, and let me say one last thing. We started an organization called One Core. This gentleman right here is wearing a One Core T-shirt, which is a service organization. It's actually a place that you can go to and join and help us. We have One Core chapters here in New Hampshire. We actually added yesterday 100 new One Core chapters around the country because people heard the message and were getting involved. And I've made it clear from the beginning, this is a grassroots campaign. My campaign is not a top-down. It's coming from the ground up because I think that's what we have to do, not just in a political campaign, but that's what we have to do to actually change this country. And you can join, any of you, your friends and your neighbors, please help us spread the message. You can join One Core by going to johnedwards.com. I have to get my cheat sheet. Or instead, if you want to text, you can text HOPE, here's the number, 30644. Text HOPE to 30644. So please, we would love to have you join this grassroots effort to change this country. And now I'm going to start taking questions, and why don't we start with this gentleman right here, and I'm just going to kind of move around the room back and forth. If you don't mind, tell me your name and where you're from.
Ralph DiBonato. I'm from Portsmouth. Healthcare. It's part of the reason the middle class is disappearing. And the middle class is who's supported this country from historically.
Yeah.
How do we correct healthcare without making insurance companies richer, drug companies richer, or New York investors? Our local hospital, which is a for-profit hospital, is part of a deal that is being consummated right now that will be the second largest buyout in American history. Now, I don't mind paying my doctor. Portsmouth Hospital.
They're buying the hospital?
It's Columbia HCA.
Oh, HCA, yeah, right.
It's being bought out by New York investors. I've never minded paying my doctor for his services, but by God, I hate paying investors for my illness.
Yeah, I got you. I hear you.
Sorry for my speech, but how do we do this without making insurance companies and drug companies richer like we've just done with the drug program?
Yeah. Well, let me speak to that first, then I'll answer your first question. I mean, it's amazing to me, and it shows you what happens when you leave responsibility to just the people who work in Washington instead of all of us taking responsibility. Because I'm here to tell you, the American people would not, if they were taking hold, would not stand by and let what happened with that Medicare prescription drug bill happen. They would never let that happen. Because, you know, we rejected the importation, re-importation of drugs from Canada, even though it would have brought prices down. And this is the most amazing thing to me, was the bill actually prohibited the government from using its buying power to get a better price. Now, you think the drug companies had a little something to do with that? Yeah. You think the fact that they had lobbyists in Washington? You know, I do. I'm just going to brag a little bit. Before all this stuff with the lobbyists in Washington happened, when I actually first ran for office, I made a commitment not to take any money ever, and I never have, from a Washington lobbyist. And I'm proud of having made that commitment. And I stand by it. But that's a perfect example of the drug companies getting their way and everybody in America paying a price in the process. I think the health care presents a difficult challenge. I right now am working on a health care plan. I've been working on it for months. I'm not finished with it yet, otherwise I'd tell you exactly what it is. But it presents the very question that you're asking. How much is the government going to do? How much is the private health insurance sector going to do? And how do we marry the two in an effective way? And it's a complicated question because you can do it, if you build on the existing system, you can do it less expensively. Oh, certainly in the short term, you can do it less expensively. Maybe not in the long term, but in the short term, you can do it less expensively. But you have to find ways to control some of the very costs that you're talking about and some of the profits that you're talking about. The flip side of that is, if the government plays a larger role along with individuals, and you remove the employer from the process, which is another system for providing universal health care coverage, it costs more to do that. But it's more mobile, it's easier to use, and it absolutely makes certain that there'll never be a question about coverage for any single American. And so the issue becomes not only which is better, which health care plan is better, but how much can we afford to spend on it? Because you also know you can't ignore the fact that we've got deficits as far as the eye can see. So you have to make the decision in the context of the fiscal situation that we're in this country. And it's not an easy judgment, and I haven't made a final decision about it yet. So, but I will very soon. The one thing I can commit to you with absolute certainty is I will have a universal health care plan for America in this campaign.